hesitation to embark upon those practices. And what that has done is made a lot of changes in the billing and collection space. So if you think about it, you mentioned earlier the rise in medical debt. There are 100 million U.S. Folks right now who have medical debt of some kind.
Wow.
And if 100 million people were not able to afford or have the means to pay that debt, then that could put them in some kind of undue stress.
Right. Okay.
So if you just look at that as a problem, the solution has always been traditional collection practices. A
Hmm.
hospital does everything they can to collect the account. It ages until it's 120 days. Agencies are involved at 120 days. And if agencies can no longer report credit, then that means that practice itself is too costly. It's high risk and it's not helping the patient. So all of these changes are really impacting what solutions are meaningful today and certainly relevant.
Right. So, I mean, that's super interesting and obviously has a huge impact on how you deliver those kind of services today. Do you see that the traditional services that you kind of described in the beginning are still applicable, or what kind of changes do you see that are needed kind of like to shift into today's under the new policies that you're talking about and sort of the new age of technology?
Yeah, so they are shifting for sure and should shift. This is what really drives innovation. So if you think about what hits the headlines as you opened up today, I always cringe when I see the front page of a paper highlighting a hospital who's done their very best to try to resolve an account that a patient owes, and that patient is in undue stress as a result of a billing or collection practice. And most of the time, that means their credit has been affected or they have perceived aggressive collection tactics,
Hmm.
which really run counter to the hospital's mission and
Right.
everything they have tried to do to help serve that patient. On the flip side of that, hospitals deserve to be paid for their services. And
Right.
communities can only be great communities if they have healthcare providers ready and available to serve them. So it becomes a real complicated problem. So if you don't change anything with your tactics, then we're really not responding to those needs as they exist. So we're here today to talk about a program that we are now offering. We think it really is revolutionary and
Mhm.
benefits the patient, the provider, and the community. So it's got a triple
Yeah.
win.
Yeah, and as you know, we work very closely, especially on the financial side, with our healthcare system friends out there trying to solve those problems. And I tell you, I've ran into situations where health systems, trying to mitigate all of those issues when it comes directly to the patients, have actually stopped in some cases using third-party collections, and kind of it's not the way to go, right? You really shouldn't stop using them. You should just do things differently, right? So, and when I looked at some of what you're doing with your new program, I looked at it and said, "Oh wow, this could be really the answer to that."
Mhm.
And not be so drastic and like let's cease all this,
Right.
So, why don't you jump in and tell us about this new program? I know you guys. One of the things that you guys have done very well over the years, over the last 50 years, is really innovate and be able to bring new solutions as the market needed them, and shift and be very nimble. So, how are you guys, I guess, positioning yourselves to mobilize quickly with the new program? And if you can dive a little bit more into the details of the program, that'd be great.
Yeah, you bet. Sure. So I'll answer this in a couple of parts. I'll start
Okay.
with, we do have a lot of history. We're a business that's been around 50 years in this particular space. And as we've talked about earlier, we were the pioneer of integration. What that meant was we saw an opportunity to help create an easier approach for hospitals.
Mhm.
And we were the first one to do that. And what has followed suit is now there's an open highway for collection agencies to transfer data. So good things come from these first followers.
Right.
I say that because that history has really inspired us to, again, move swiftly and to mobilize quickly. And this really has been in response to the most recent healthcare regulatory changes. So, what we realized first is if you think about the rise in bad debt, and also the margins that hospitals have. Just keeping things the same with the same cost structure doesn't work. So
Right.
hospitals right now pay between 10 and 20% at day 120 placement. We're offering a program that right out of the gate is 5.5%, 5.5%. So that's significantly less than what anyone else is paying now. We'll talk about how we can do that in a few minutes. But that alone is saying you should pay for solutions that have value, but you shouldn't pay more than that. So without credit reporting and things like that, and agencies losing their levers, it doesn't make sense to have a 10 to 20% structure in place. So that's the first piece of the program that's important. The second piece is 10% of our fees we are giving back to the community. This has really been inspired by all the medical debt relief programs that have emerged in the last couple of years. We're based in North Carolina, although we're licensed in every state or across the U.S. And in North Carolina alone, within just a few months of a new debt relief program, every single North Carolina hospital signed up for it.
Wow.
Everyone.
Wow.
So what we're doing is our fee structure is unique and 5.5%. We're giving 10% back. A hospital that uses us chooses where those donated dollars are dedicated. And that means that we are not only on the outside as a solution provider, we're in the inside. We want to talk the walk or walk the talk. Yeah. And then the last piece of it is really how we're doing this. And the way that we are doing this is using a caseworker model. So in my experience, I know the most difficult challenges require great thought, great intervention, great support. So if you think about healthcare debt being complicated, you really need people and resources to be able to work individually with each patient to resolve it. Old practices assume that patients haven't paid because they don't want to pay, and so accounts move to day 120. Our program assumes that patients want to pay, they just need help and support to be able to do that. And sometimes that might be understanding exactly what is owed and what resources are available to pay it. Sometimes it's really having the resources to be able to communicate with that patient with ways that engage them so that they can have the tools to be able to resolve it.
Okay, understood. Yeah.
Our new program really shifts this outdated collection solution to a service navigation program that provides the patient with the ability to engage in the resources they need to solve it.
Understood. Wow, it's pretty exciting. One of the things that you brought, well, everything that you brought up is new to me in the industry anyway, but you've concentrated in pre-bad debt and bad debt collections your entire career. I mean, I don't have the same lenses you have, the same experience, but I have been on the financial side for a long time, and I'm not aware of anyone else, especially in the collection space, giving back money to the community. Is this something that you found is completely unique to what you guys are doing in this new program, or is this starting to be practiced in the industry?
We would love for it to be a practice in the industry. We are the first one that I am aware of that is doing it. You asked earlier, how have we been a pioneer and how have we mobilized? We are 100% employee owned. So we're an ESOP, an employee owned business. A lot of studies show that ESOP organizations their employees have a greater sense of purpose. And that really plays into our decision to be able to integrate this give back feature. Unanimously, our employees said, if we're going to do this, this is the way to do it, because we don't want to just offer kind of one-dimensional value. We want it to be a triple win. And if we're giving back, then everything about our patient communication is aligned with that end in mind.
Gotcha.
Also, the way that we are serving the hospital is aligned with their mission. And we're doing everything we can to support the hospital being able to serve the community.
Right.
So it's a one-of-a-kind deal that we know of, and we are really excited about being inspiring others to follow suit.
Gotcha. And out of curiosity, are there any rules or parameters around how they spend that money when you give that money back?
Well, there are lots of rules and parameters around that, depending on if you're for profit, not
Got it.
profit, and
Okay.
everything else. But what we will do is work with every provider to decide where they want those dollars donated, and
Okay.
then every quarter we will provide we will direct deposit those monies into the funds that they've established. And as you know, hospitals have many funds from 5 different funds that are
Right.
regulated by the state to their healthcare system or their state-run funds. So what we want to do is let the hospital choose where these should be directly designated.
Understood. That's pretty exciting, actually. And now that I'm thinking about it, it's really, you said there 5.5% as a fee, but then you're also giving the money back, so it's lower than 5.5%, right?
That's right.
Okay. So in essence, it really is lower, which is amazing. And I want to get into the tech because I'm a tech geek at heart, right? So, but before we do that, for those who might not understand sort of the model that you talk about, you talk about something totally different that I haven't heard about before, which is that Caseworker model, I think you said, and then in service navigation. Can you just spend a couple minutes on that a little bit more so I can understand that a little bit better? And I'm sure that others in the audience will want to know what that means too.
Yeah, you bet. So if you think about a patient experience today, most of the time, if the patient has gone 120 days, then the communication is pretty one-dimensional. They,
Hmm.
have to receive a validation notice. Then there's a series of letters and calls that take place. All of that is with the intention of being able to connect with the patient.
Right.
Usually, those go unresolved. Payment plans kind of spark some interest,
Yep.
but it's a pretty simple linear approach.
Okay.
And to be able to accomplish that, there are great tools and technologies that are there, such as what is one's propensity to pay,
Hmm.
what is the pathway that makes sense, and all of that is workforce automation that is
Yep.
built and is not new. We have been able to take all of our data from being in this space for 50 years and really create personas based upon a particular patient. And
Hmm.
with those personas and utilizing workforce automation, our approach is we are welcoming the patient to a service navigation tool, helping them with our communication to say, we are here to support you in your endeavors to try to resolve this account. And so to be able to do that means we have an omni-channel program that is enabled by AI to be able to, on the fly and dynamically change the tempo, the time, the tone of our communications, and how we are engaging that patient so that they interact and work with us. So all of that
Okay.
is something that our research and history enabled us to be able to build. And
Hmm.
with utilization such as what Deepak will talk about, it is transformative.
Understood. So this is, yeah, it really is a true collaboration between, a new model from both how you're, and basically how you're operating every day with your staff, and as well as augmenting that with this AI technology to, you know make it more efficient and in less hands, I guess, on the workflows, if you will, right? So and really helping those people who are these caseworkers enable the job to be way more efficient than it has in the past.
That's right. I mean, it's all about what's your end goal? What are you trying to do? And so
Yeah.
we're really we're letting go of this idea, this old concept of we're trying to collect from the patient.
Yeah.
We're trying to do instead is we're trying to serve the most vulnerable, because the most vulnerable in the
Yeah.
healthcare system are the ones who haven't been able to pay as of 120. And
Right.
if that's
Right.
the case, with them being the most vulnerable, you have to change the approach.
Right.
Today, up until today, agencies and firms, experts have really relied upon um, this one-dimensional approach, just trying to
Yeah.
squeeze blood from a turnip, doing the same thing again and again and not getting any result. And so we've really engineered this so at the very beginning of our communication with the patient, they experience us differently. And as a
Okay.
result of that, they've know that they are being helped, and they know that there is a way to resolve it. All of that is dramatically different.
Okay, excellent. I got last question for you regarding the program. It's two parts. All right. So number one would be, you know, how will the use of AI make the patient experience different, you know, specifically? And number two would be, since this is new, I'm sure, but you've had data forever. As you said, you've been doing this for a long time. What are your expectations and the outcomes of this new program?
Yeah, so a way to think about this is if there are 10 people in a room and every patient, every person is a consumer of healthcare,
Mhm.
each person would say that what would motivate them to be involved in an unresolved bill is different. Every single one is different. And
Okay.
so what we are able to do with AI is be able to dynamically engage that patient based upon their own preferences. And so we've enhanced machine learning with our data that we've been able to compile so that we are working with that patient based upon the needs that they
Mhm.
communicate and convey. And so we are able to do that with this service navigation engine. So it's that
That's
flexible.
awesome. Yeah.
It's
Yeah.
that
Yeah.
adaptive in the outreach. Yeah. So that's
Fantastic. Yeah, that's great. So, very exciting new program. I'm really looking forward to working with you in the industry to test this out, see how this goes. I think you know, from both the new approach as well as the technology on the covers, I imagine, and the new and a lower cost to do this, you know, has to be a success. So we're really excited to go to market with that. I want to transition now. Now we've heard like an amazing new approach, and what I've seen, I'm sure that the same AI bots somewhere in collections that they're doing things nothing like this. You know, kind of really thoughtfulness of putting this into a full program and working around not just technology, but you know, agents, but actually putting an entire program together. It's very unique. It's one of a kind. I can't wait to get to go to market with this. On Deepak, on your side,